Hey, welcome to another episode of Beyond the Exam Room. All right, we thank you all for joining us. And today we're very excited to have Brielle Norton, Executive Marketing Director for Visiting Angels. And I am certain that most of you have heard Visiting Angels. And so let's all give a warm welcome to Brielle. Welcome. Say hello.
Hello.
Okay. So the first question I asked Brielle was, it's a very interesting name, and so I couldn't help. So she spells it Brielle, and I don't know about you, but that's the first time I ever ran into that name. So I asked her, I said, where did this name come from? And your answer was?
My mom.
And she had no inspiration on where it came from or anything, or?
I'm not sure exactly where the name comes from. My first legal name is Bailey, and then my middle name was supposed to be Brielle, and I have a great grandma who's Marie, and
Okay.
she was not letting that go, and so I ended up Bailey Brielle Marie.
Okay.
So.
Well, if I had named Brielle, I would go with Brielle too. So I bet it makes you very unique,
Yes.
which is awesome.
Thank you.
Well, thank you so much for being here. And one of the things that I'm so glad you're here is because I'm sure you're being the marketing director, you understand that we're in the middle of a huge tsunami that we have no answers for, which is that everybody knew that the biggest population that ever happened in the United States, which was what? The baby boomers, that they were going to hit. And we knew it was coming, the tsunami was coming, and the reality is that nobody did anything about it. And so what you and your team does for me, being a geriatrician, I just can't say enough of the value that you bring. Okay.
Thank you.
And I'm sure I would love to discuss some like real cases with you. So a couple of things. One is that Visiting Angels, what you explain to the audience exactly what you all do.
So we are a non-medical in-home care. So we come out to the home and we help with everyday assistance, bathing, grooming, dressing, light housekeeping, meal preparations, transportation to and from doctor's appointments or errands. We have a minimum of 1 hour to 24/7 around the clock care. So we're really based on the client's needs. If we have somebody that, sometimes needs us twice a week or, around the clock care. So that's kind of what we do is we come out and we help with getting them, dressed or getting them ready for the day, doctor's appointments. So, yeah.
So one of the things that I have to explain to my patients all the time is that your services are not covered by typically Medicare or Medicaid, what they're used to, or insurance. So they mistake that sometimes for home health and skilled nursing and things like that.
Yes.
But you did tell me, which is very unique for Visiting Angels, which I really want to highlight, is that that you do for certain Medicare patients that have Part A and Part B, that have Alzheimer's or dementia and what other diagnoses do you cover?
That is it.
Okay.
Alzheimer's and dementia. So if you have a patient that has Alzheimer's or dementia and they have traditional A or B Medicare, they could qualify and get up to 78 hours of free respite care for the year.
Which is phenomenal. I can't tell you how much that helps. So the first question is, how did they go about applying for that?
I couldn't answer that, unfortunately.
Okay.
That is something that higher up went and did all the paperwork and processing. They just kind of brought it to me and was like, hey, we have this great service and we're able to get 78 hours of free respite care for these clients, and we're the only home care in New Braunfels that does offer the service.
Yeah, which is very unique. So for our team members that are out there and concerned, so the best way to go about trying to tap into that is to call your office?
Yes, you can either call me or my office.
Okay.
We're also locally here in New Braunfels. We're off Common Street in Dr. Keller's office.
Okay.
And we can get you processed. It doesn't take very long typically to
Qualify?
see if somebody qualifies or
Okay.
gets denied. We have an amazing team in our office, Courtney and Carrie and Ashley. And Carrie's typically the one, she's our in-office manager. And she'll go and see, does all the billing and does our sign-ups and goes to see the clients. Courtney does scheduling, and then Ashley is our branch manager.
Okay. So obviously we're touching on a broad subject here, which there's just a huge need and there's a mismatch between demand and supply, right?
Mm-hmm.
And so what have you seen from your perspective? What is the most, what's the most difficult part of your job, would you say?
Ooh, the most difficult, I think for me personally, is we see the kind of help some don't have at home.
Yeah.
And I think that's what's hurtful and hard is there are people out there that don't have families. They don't have friends that can come and help them and do these services for them. And so thankfully we are a service that is able to get out there and help them. But that is probably the most hard about my job is going in and seeing those patients that really don't have anybody.
Yeah, it's heartbreaking because you really want to help them, but they just don't have the financial resources, right?
Yes.
And so that's one of my big pet peeves is that really, and I always tell people this. I tell my care providers and my clinicians is that if you really want to know what the status of your patient is, especially in the elderly and the frail, go visit them at their house.
Yes.
I mean, when I first led off in our house call program, it was mind-boggling. You just walk in the house and it'll give you a really holistic perspective of what that patient is going through.
Yes.
And it's really unfortunate that, and which I'm really excited about where healthcare is going. I think healthcare is definitely going towards home-driven, which is great because leveraging technology, we're able to do wearable technology, remote patient monitoring, those kinds of things. And so the services that you provide at the home is just absolutely invaluable, absolutely invaluable. So I know it's hard for some people to kind of grasp, but just think about if you have arthritic hands and your hands are like this and you can't even grab dishes, think about that. How do you even cook a meal or prepare a meal? Mm-hmm. Or how about if you have severe macular degeneration and you can only basically tell maybe light, very light. And so, you can almost be a prisoner in your own home. And I'm sure you've seen that, right?
Yes.
And can you describe some scenarios that you've seen like that?
I mean, there's a few. We've had some that, like I've said, they don't have family. And of course, when you don't have family to come and help and take out the trash and make meals or do any of those things, that's when things get really hard. I mean, I've had some where we go into the home and unfortunately there's trash everywhere and just some even have animals that they're not able to take care of, and it just is a really unfortunate situation.
Yeah, it's very sad, and you really, only way, like I said, you can tell is you actually have to go to the home. That'll give you a really, really good idea on what's happening in the patient's life and their mentality and their what's happening. So what happens with, let's say we tap into your services, okay, and obviously you go by per hour, right? Is that correct?
Yes.
Okay, and it's minimum of 1 hour, right?
Yes.
And what's the maximum per day? Can you go 24/7?
Yes, we are on your schedule. So if you're private pay, it's as much as you need us. We have some that are 24/7, 7 days a week. We have some that only use us 1 hour a week.
Okay.
It's really based on the client's needs.
Okay. Let's say I have a client and they're paying for your services, but they need to go to the grocery store or a doctor's appointment. Can Visiting Angels provide that?
Yes. We take them to and from doctor's appointments, to run errands. It's just dependent on if we're using a client's car or a caregiver's car. But yes, we are definitely able to help them we've had some that we can't always, if there's a situation where we weren't able to staff it, we're gonna make sure the client's needs come first. I've even personally had to take clients into their appointments. We can even do it to where they go into a doctor's appointment, sit on the doctor visit and kind of take notes for the son or the daughter, whoever, or if they're having kind of an outpatient surgery, those things we're also able to kind of go and wait and help them get back as well.
Yeah, I will tell you what drives me crazy, Brielle, is if you actually look at the whole healthcare continuum and the cost, mm-hmm, and I've done this on lectures and I've actually presented this, it's absolutely insane. The amount of the money that we would spend for your services that you provide for patients that are virtually almost homebound, mm-hmm, versus the traditional route, it would be just pennies on a dollar. Just think about it. All the stuff that you can do, you can help them bathe, fall prevention, all these preventable things that cause patients to go to the emergency room, then go to the hospital, then they go back to their home, then they have another fallout, and then they go back to the hospital. And I have a saying with frail and elderly, when they get discharged from the hospital, that's not the end. That's actually where the beginning of the risk starts. That's what people have to understand. You agree with that, right?
Yes. 100%. That is where it all begins, and that's where hopefully we're able to kind of come in and limit that situation, like you were saying, the fall risk. We also just do companionship, where we have some where they're scared of mom getting up at night and falling or anything like that, and we're there 8 p.m. to 8 a.m. just there to make sure mom doesn't fall. So
I think there's multitude of levels here. I always tell my patients that have, caregiver burnout. I'm sure you've seen that. And I always tell them, and they feel guilty. And I said, listen, if you don't take time out, and you get burned out, you become less, what I call result. You provide less results, and you become a worse caregiver when you're burnt out. And I always tell them, I'm sure you tell them the same thing, right?
yes.
Like you really need that time out to re-energize, because you can't run on empty. If you both are running around empty, it doesn't work.
Yeah.
And so I know it's from a cost perspective, it seems like a lot, but even if you can afford 2, 3, 4 hours in a week
Yes.
to break that up, it becomes absolutely invaluable, honestly.
Yes.
Well, would you agree with that?
Yes, you can't help somebody else if you can't help yourself, and I think I stand by that. And that's kind of where the guide program would come in. If you're like, oh, I just need like a couple hours to myself, like once a month or twice a month or whatever, that's kind of where that would benefit from a lot of people, because I know it's not a lot of hours, but it's still something. And so I think that's where it's most beneficial for sure.
Yeah. And one of the things that you mentioned, I think is so important, is you were talking about companionship.
Yes.
And people who are homebound and lonely, I mean, to me, loneliness and isolation is another form of chronic disease. And the studies, the data clearly points that the outcomes are much worse, right?
Yes.
And so just even giving just comfort and making them feel like they actually matter, and hearing their name, and you actually bring them to the forefront where they're actually make them feel like their life matters, that itself is a win in my book, you know?
Oh, absolutely, yes. I mean, we have some we go in there and we just play puzzles with them,
Yeah.
or we take them on a walk, and just something to kind of get them out of the house and make them feel better. So, yeah, I think companionship is definitely a need, and it's very important.
And again, it goes back to dollars and cents in the healthcare market. I mean, if you really compress the value that they bring to a home and versus the whole healthcare allotment, how much it costs. I mean, to me, that's the part that's very frustrating. I don't know how they don't incorporate like home visits and home health and provider assistance and caregivers. Why that would not be encompassing in part of the care group for the senior. To me, that's mind-boggling. I just don't understand that.
No, I agree with that 100%. Hopefully that'll change in the near future. So,
Yeah, I would love your help and doing podcasts like this to understand. People have no idea like the amount of suffering that happens just even in New Braunfels. I mean, we had the seniors center here, and he quoted like over 30,000 Meals on Wheels last year. Yeah,
oh wow.
they delivered like 30,000 Meals on Wheels. So their food insecurity, all those social determinants of health that we think it's elsewhere, but it's right in our own backyard. And I'm sure you see this every day, right?
Yes, and that's kind of where we come into play, where we even have clients that it's hard for them to bend down and grab groceries even if they have it delivered. And that's where I'm most proud of us, is that we're able to kind of help them get into just the everyday regulars of living. So that's where we can help them put away the groceries and make them little meals and things like that. So keeping that quality of life is very important.
So I really, I'm so glad you brought that up. It's so funny because I hear people like, well, if they have the resources, what's the big deal? Why can't they just order Uber Eats? Or why can't they have HEB and delivery and stuff? But that's just a start. Just think about it. If you can't see, you're debilitated, even if they deliver the groceries straight to your front door, someone still has to sort it out, put it in the refrigerator. But on top of that, think about the cooking and the cleaning, the laundry, and just the turmoil of just trying to even getting a bath. I mean, it's really, really difficult, right?
Yes, it is.
That's one of the perspectives I think is really important. Like I said, the things that your company does and what you do is so invaluable. Just giving companionship, just being able to help them to just do the activities of daily living, just being able to eat and drink, bathe, going to the toilet, that kind of thing, you know? I mean, we just talk about just I call it dignity, right? You want dignity in the home, and I feel really sad that we're not able to do that for our own, or our own senior citizens. That's the part that really breaks my heart.
Yes, it is very sad, and especially, I mean, for those that have served us, like veterans.
Yeah.
I mean, we're very big on the veterans. We're preferred vendors by the VA. We also have put on, back in 2024, we started the Veterans Resource Fair here in Texas, and we've now gotten to a point where we're partnering with the New Braunfels Senior Expo. So
That's
it's great to
awesome.
be able to bring those resources to them and
Yeah.
to be able to have them in front of them, and that's probably the most rewarding part.
That's
So,
awesome. Obviously, we can talk about this forever. We're kind of wrapping up, but I want you to, if you had like children
mhm.
of these elderly, or you have relatives of these elderly people that are, what's the best advice, looking in the camera, can you give to them right now about making sure that they do all the things necessary, planning the correct way, so that their parents or grandparents can live out their life in, healthy, and also with what I call with dignity? What would you advise them?
I would advise them to first look at their insurance plans, making sure that they have a long-term care plan, um, and honestly, make sure you check your resources and you're getting enough information from everyone, making sure that that mom comes first or dad comes first, and making sure also, like you were saying, caregiver burnout, make sure that you're taking time for yourself, because like I said, you can't take care of somebody else if you're not taking care of yourself. So I think that would probably be my best advice, would be to honestly have everything aligned early on, and yeah, I think that would be it.
Yeah, and the other thing is timing. I always tell
Yes,
people,
yes,
it's like you
timing.
can never start planning too
Yes.
early, right? Would you agree with that?
No, I agree with that 100%. It's like, I mean, my mom's been doing this for 13 years, and so she's already she's like, oh, I already have my plan, and
Right.
I've got it already.
Exactly.
So
That'll be
yeah.
good for you, I
Yes,
think, right?
I'm like, oh, good, okay. But yes, no, it's very good to kind of have those things set up early and kind of be able to come up with a plan and sit down as a family, because I know it's a scary thing to talk about. When your parents or grandparents start getting to that age, it is a very scary thing to talk about. Um, but it's definitely a need, and it's definitely uncomfortable, but definitely needed conversations to have, and to make sure there's a plan in order, and that everyone agrees to the plan and can go along with the plan for sure.
So, any ideas from your perspective to make it easier to have the tough discussion? What would you recommend?
Ooh. Honestly, it's already hard as it is, so why would I want to make it harder? If you can do what you can ahead of time and to plan, then why not just do it and get it done? I know it's uncomfortable, but get it done now, so that way it's hard now, but imagine how hard it's going to be in 10 years or 20 years. So I
Yeah.
think that would be my advice.
That's great advice. So, again, folks, this is Brielle Norton with Visiting Angels. So, look them up, okay?
Yes,
Thank you so much.
thank you.
See you next time.